My name is Kavana Cook, and I will be talking about considering the negative long-term effects of birth control. While birth control has positive effects on the health of women, it initially contributes to possible health risks that can be even harsher on women who take birth control rather than those who do not. So we all know what birth control is and what it is used for, but do we really know the internal effect it has on our bodies? To answer that question, essentially no. So what do we know? Although birth control has been sold over the last 70 years, the underlying effects posed on individual women should be more considered in the distribution of the contraceptive. We know through research that birth control can help with many gynecological diseases, but does it essentially cure them, or does it just keep them in control while making a way for other possible complications to happen? That's what I'm here to initially discuss. While it is known to help with abnormal bleeding and relieve symptoms of PMS in women, the severity of the side effects can vary among individuals. So the question is, how can this be accommodated for? So as we know, the birth control pill was approved in 1960 and is one of the most used contraceptives in the United States, but historically there have always been disagreements about its use and its effect on women's bodies. With that being said, the more we know and understand about birth control as a population, the more we can consider creating safer, healthier alternatives that would benefit future generations. So what else do we need to know about the negative effects of birth control? To begin with that, the use of birth control has gradually decreased as the ages of women increase, creating a directly proportional relationship between them. From a study on birth control in relation to hyperthyroidism, stats show that 54% of women who used the contraceptive were under 20 years old. 35% were between 20 and 40 years old, and then 11% was 40 and 45 years of age. This growing popularity of birth control within the younger age groups has called for a lot of further research into the long-term safety of being on the pill. So historically and leading up to now, we have known birth control to be used for a variety of reasons besides being a contraceptive. It is used to treat gynecological disorders such as endometriosis, hormonal imbalances, and abnormal bleeding. However, researchers and doctors mention and do not press on the underlying side effects and health risks that are posed on unsuspecting teens and adult women who use any method of birth control. Additionally, it has been said that long-term use of birth control pills can bring many effects, including increased risks of hypertension, breast cancer, and serious autoimmune diseases. This can also include elevated levels of cholesterol and the creation of blood clots depending on the person. Each of these examples can lead to a multitude of what we call non-communicable diseases, which include heart disease, diabetes, chronic diseases, and some forms of cancer. So breaking the chain of unknowingly consuming harsh drugs that could effectively contribute to the overall health of women in the generations to come, and could possibly lead to scientific discoveries to benefit more specific and diverse populations of women. Essentially, we want birth control to be harmless and effective, but it's not. We need to know that not every prescribable drug needs to be consumed. So to truly understand this, we need to know the depth of that situation. So knowing the different methods of birth control and how they can pose different threats, cause adverse health effects is the number one step to limiting consumption or just stopping its use altogether. Hypothyroidism, which is a pathological hormone insufficiency, is a prime example. Studies show that the thyroid hormone is crucial for growth, energy metabolism, and reproduction. So hypothyroidism is a product of birth control corruption. It can be associated with a high risk of morbidity or mortality as it progresses. So I want you to imagine and put yourself in the place of these women. Would you rather deal with the natural occurrences of your body, or would you rather have unpredictable hormones put into your bloodstream that could lead to serious consequences? Think about a woman who takes birth control to control her menstrual cycle. She unknowingly has blood pressure or thyroid problems. Without considering those side effects, she introduces the hormones into her body in a slow, steady dose, but it's still contributing to the hormones her body is already producing. With that being said, this increase in hormonal activity will inevitably contribute to negative effects on this woman's overall health. She is now subjected to possible hypertension and hypothyroidism. Birth control contraceptives are definitely a gateway for other problems to sneak in and take over a woman's body. So why would you want that rather than allowing your body to naturally produce what is needed and use safer methods of birth control? This thought process will initially greatly benefit women in decision making on the subject of birth control, allowing them to really weigh the pros and cons, done by researching its effects, and will gradually prevent the unsafe usage of birth control. So, considering what is known about the benefits of taking birth control, we need to consider what is not mentioned as much, these negative effects. Yes, it prevents pregnancy, but it's not something that's naturally produced by your body, so it can be very well dangerous. Think about how birth control can negatively affect one's body long term and cause autoimmune diseases while contributing to hormonal imbalances. The JAMA network provides evidence that studies had found associations between hormonal contraceptions and unintended outcomes. This ensures that clinicians must weigh these risks carefully when giving patients access to birth control. They need to know that it could possibly affect that individual. So overall, without knowing your health history or knowledge of potential dangers you could face, birth control is inexplicably not for you. You never know how things will affect you, and it may seem like a great idea for short-term needs, but think of how anything will affect your life long term, because it is for the rest of your life. Thank you.